Preparing to live stream.
I think. Hi everyone, hello. Just a couple of minutes late. I wonder if Dr. Lise is going to allow us another minute at the other end. She's pretty strict, isn't she, with us answering your questions. Anyway, we're here again for you today, and 6 o'clock UK time, as we always are on a Thursday, and we are the Holistic Vet Sisters, a group of holistic vets that are all in a sisterhood to help you and to answer your questions. So if you have questions while you're watching today, you can post them in the comments. Also, do post questions for any of the future vets, holistic vets that we've got coming on in the next few weeks as well. And we can always get to your question then too. So this week, though, there is, as usual, myself, Caroline from the APNC, Dr. Lise Hansen, Dr. Tina Hansen, who goes by PurpleVet. And today we have another guest, another holistic vet sister with us, and her name is Rikke, which I think, or it's maybe pronounced a little bit more like reggae, which is very exciting. So she's in Denmark as well. Hi, Rikke.
Hi, and thank you for having me coming on.
That's okay. It's our pleasure. We want to meet as many holistic vet sisters across the world as possible and build a really wonderful network of support, really, for guardians of all sorts of pets.
Okay.
Are you happy to introduce yourself, Rikke? Because you've got a long...
Yeah, I can do that. Yes, I have a long... Actually, Lisa and I were studying veterinary medicine together. So, and I actually started being interested in holistic medicine right when I was studying, because I was driving around with a vet who had been in China learning acupuncture, Katrine Langved. And then we had a really good society of integrative medicine at the vet school who was really good at arranging courses like in acupuncture, homeopathy. We had Christopher Day coming over. So I already got the idea of thinking holistically when I was studying. And that really helped me when I finished. I went to Iceland. I was married to an Icelandic man and had my practice there for 5.5 years. And the farmers there were really positive about using acupuncture. They had no clue of what it was or how it worked, but they just like, if it works, you use it. So I got really into using acupuncture and some chiropractics right away when I started practicing. And for me, that was really good. I know people who start doing holistic medicine later after they have been working with veterinary medicine for maybe 10 years. It's much harder to do something else, because what is fast and you don't have to think so much. And if you have a busy life, then it's hard to incorporate a new modality. So I've been lucky in that way. And in Iceland, I use acupuncture a lot for horses with back pain, for instance, but also for cattle with infertility. So I was driving around do inseminations of cattle. So it was easy for me to treat them right away with acupuncture if there was any problems. So when I left Iceland, there was quite a lot of young cows that were called Rikke, my name, or Needle in Icelandic, because they were given those names because of how they were coming out. So I also used it a lot for cows giving birth. It's really, really, really strong for that. So infertility, and there's been a lot of studies in infertility in humans and acupuncture. So that's a very good thing to use. Then I took the international veterinary acupuncture education back in the 95 I finished. And then I moved to Denmark and worked in a solely equine practice for 8 years. And I studied then osteopathy with a guy called Pascal Lewat from Belgium, an osteopath from there. And I used acupuncture and osteopathy for about half of my time then the regular job stuff too, but half of the time it was that, so that was nice. Then after 8 years, I stopped there and started my own holistic practice with mainly horses. I do a little dogs too. So for over 20 years, I have had my own holistic practice. And to begin with, I had to convince people that I would like to use acupuncture, for instance. But now people come because that's what I do. So that's a huge difference. And over the years, there has been a development in that aspect, and it's mainly comes not from the vets, but from the customers, from the clients who starts to know about acupuncture, osteopathy, chiropractic, so that they are asking for it. And that's here in Denmark, there's a lot of the big clinics and practices that have vets working for them because they know acupuncture or chiropractics, because they know that's what the client wants. So we have educated the clients very well. Now we need to educate a lot of more vets, because we need to have people look at the animals from a holistic perspective if we want to heal them, and not only symptom treat them. So, but there's still a way to do that. Then I thought I missed something. And that was especially treating horses with behavioral problems or anxiety or whatever they had. So I thought about learning about Chinese medicine, because that would, or Chinese herbs, because that fits in with the TCVM theories about acupuncture, and then you can just fit the herbs into that. But I thought, well, I never learned all those Chinese words about how the names of the herbs. So I gave up on that. And then I was so fortunate that Lise was collecting a group of people and teaching homeopathy. So I was fortunate to take part in that, Lise. I thank you for that.
That was wonderful, yeah.
Yeah, we had it 3 years, three years, I think. And then after that, I have, with the rest of the groups, taken dynamics course with Jeremy Shear and for humans, and that's just fantastic. So I love my homeopathy too. I mainly use that for behavioral problems connected with the musculoskeletons, but of course, if anyone come with an animal and ask for help with internal things, I'll do that too. But my approach is more from the biomechanical and adding on the homeopathy, but with great success. It also, then if they calm down in their mind, then it's much easier to treat the body. So it's really connected. Then in 2011, I had taken a couple of courses with the human guy, Thomas Myers, who worked with fascia in humans. And so I called a teacher at the vet school, a colleague, and talked to her about if we could dissect some horses and dogs and look at the fascia in them to see if they have this myofascial meridians, as Thomas Myers names it. And I actually have this book here, if I can just get it out from under my computer, so I can show you. So if you know that, this is the book, Thomas Myers. This is a 4th edition, I think. There's other front pages on the other ones. And then we started out dissecting horses, and it has been a huge project. We have then had a collaboration with Tove Due, another vet, also holistic vet, and she has found points for treating the fascia in horses in a pain-free way, because a lot of the treatment methods in humans are very painful. And you cannot do that with animals. They will kick you or bite you or scratch you. So don't try that. So Vibeke Elbrand, who is the associated professor at the vet school, and I and Tove Due have written a book about the fascia in horses and the myofascial kinetic lines and how to treat them. And we are about to put the last hand on a book for canine, also for the dogs. So
have you got your book there to show us?
Yes, maybe have. I have built it up under the computer.
Your computer is going lower and lower.
Lower and lower. So here is the equine book. So the next one will be Canine Myofascial Kinetic Lines for Professionals. And it's we're working on the last picture. So I guess during the summer we will be done. So late autumn, or maybe in the autumn, yes, we will have it out. So it has been a very exciting travel, because what we have done is anatomy. And in looking at how the fascia connects the whole body in a three-dimensional web, we can also explain why we need to look at the whole animal and look holistically on it. So there's no doubt about that. That is anatomy. That's not acupuncture meridians with chi flowing through the meridians, which can be very hard for people to understand. So this is hardcore anatomy, and I really hope that can bring a basis for other vets to start to look at the holistic way that we do already. So that I would love that, but it takes time.
But Rikke, now that we have you on here, can you explain a little bit for people that barely know what a fascia is? Like,
Yeah.
what is it, and how, and what kind of diseases is it linked to, or why is it important?
Yeah, I can do that. So fascia is a three-dimensional web in the whole body. And it actually, like a muscle, when it builds in the embryo, it starts out as connective tissue or fascia. And then the muscle cells grow into the muscle. So it means that fascia is there as the first thing. And then we also if the same thing with the liver. So the liver is, the skeleton of the liver is constructed of fascia, and then the liver cells grow into the liver. Same with bones. The bones are actually fascia skeleton with calcium composites embedded in it. So when you understand that, you understand that the whole body is connective tissue or fascia, and it's related and it's connected in a three-dimensional web all over. So that means also that if there is a contraction in one area, it will pull all the way. So let's say that I hurt my foot and I walk in the wrong way, it will pull and contract the fascia all the way up, and maybe to the diagonal shoulder. And if we then only have pain in the shoulder, treat that, but if it comes from the foot and we don't treat that, we will not make the patient healing, because we have to that's why we have to look at the whole thing. So fascia can contract, and we have the myofascia, which is around the muscles, within and around the muscles. And when that contract, it makes the muscle stiff and the whole body stiff. And again, if we hurt ourselves or the animal hurt itself in one area, it will pull through the whole body. And that's why, to me, it's so important that we look at the whole thing. I had a teacher once say to me that pain is the biggest liar. And I think that's probably one of the most wisest thing I have heard, because the area, if something happens and you hurt an area, then very fast it will just, all the fascia and muscles will contract to protect the area. So then it stops hurting. But something else then have to work harder. Like if it's the middle of the back, then the last part of the back have to work harder. And then that starts to create pain. So the pain is very often in the secondary,
Location.
The compensations, I want to say. That's painful. And if we only treat the pain, because that's what we learn as vets, to find the pain, because that's the easiest thing to find, because they will tell you when you hit it. We only treat the pain and we lose the main problem, which is the most restricted area. We haven't cured them. So pain is the biggest liar, and the areas of the greatest restriction is often the main course. So you have to treat both if you want to really get it going. And for me, that is what the myofascial kinetic lines, which is lines running over the body. I can maybe find what did I do with my book? It's here. I can find a picture here showing you. So here is a picture of a horse where we have painted 3 different lines, myofascial kinetic lines on the horse. So the back line is the green and the belly is blue. And then we have the side line, which is the orange. And those lines, the back and the belly line, they will control the flexion and extension of the back. And the orange line will control the side bending. And if we look closer at these lines and know about acupuncture, we can see that that's the same. It's the same way they run the acupuncture meridians. So this has been in there all the time. We have just been able to dissect out where they run. And that can really show us how it connects the body, because if I can see that a horse has pain in the last ribs, I can then follow that sideline, and maybe it comes from the neck. So it's a way, it's a kind of map where you can follow, okay, we have a problem here, where does it come from? And then you can cure the patient much better. And as I say, this is pure anatomy. You cannot say it's something that isn't there. It is. And when you understand that wholeness and how everything is connected, then you have to understand how you can treat that. And then you have to dive into holistic medicine.
That's incredible.
It is.
And it's also interesting now that we're on horses. I did want to ask you, because where I live in Norway, it's a huge thing recently that everyone realized that maybe castration, even in horses, does have some side effects. And then they realized that maybe this fascia gets really tight, and that's why some geldings are struggling so much. So now they're started doing some kind of treatment where they go rectally and they try to release this tension. Can you talk what you think about the treatments?
Yeah, I can, because it's really interesting. Because when I worked in Iceland from 1902 to 97, it was a fashion disease from the trainers. They saw that all the geldings had problem with the castration scar. All the geldings that they couldn't manage, they would have re-operated. It was then a problem when it was the mare that they couldn't ride, because then they didn't have the excuse. So at that time, a lot of geldings were re-operated, like you open up along the castration scar and release the tension and remove the extra scar tissue. And a lot of those horses had other problems. They had maybe back pain or spavin or something like that, because it show up like with the same symptoms. So for me, it's you really have to be good at diagnostics to find out if it is from the castration scar or something else. So there's a lot of differential diagnosis. So that's first thing, you have to be sure of your diagnosis, which means that you have to rule out back pain. You have to rule out lamenesses, bilateral lamenesses, if they have pain in both hind limbs. They don't appear lame, they just are take short steps like they do with the contraction of the castration scar. So now it's funny, it was a fashion disease then in Iceland. It's over 20 years ago, 25 years ago, more than that. And at 30 years ago, oh my God, am I that old? And now in Denmark, it has been a fashion disease for the past, I don't know, 10 years or something like that. And it's easy to examine a gelding and make it kick at you if you just pull on the castration scar. So it looks like that is a problem. But you really have to be much more accurate in your diagnosis. So it should, as you say, there's a lot of them now in your place, but a lot of them is not castration scar, it's something else. So I'm quite restrictive with that diagnosis. I really try to rule everything else out first, because the next thing is you then have to look at what is it about the scar that's a problem, because there are actually more problems. So it could be that the fascia around which is lying around the testicle has grown down into the skin, or the scar in the skin. And then there is a restriction, because the testicle is in the embryo, starts where the kidney is. So in the lumbar area, and then it is pulled down into the scrotum. So if there is a connection in between this fascia from the testicle, from around the testicle and the scrotum, there's a pull all the way up to the lower back. So that is painful. And interestingly enough, in dogs, there is a pull forward from that area where the testicle was built originally to the diaphragm. So I actually had a dog with front limb lameness that came from the castration scar. I haven't seen that in horses, but in dogs, they have a connection from the area of the original testis to the diaphragm. So that is, again, you need to really think holistic to get that connection. But I got that from all the dissections, and Vibeke Elbrun, my colleague, had seen that. So that's why I realized. But in the horse, it's going to the lumbar area, and then they tense up in the lumbar too, and they might walk awkward on their hind limbs, so they get joint pain too in the hind. So you really have to go around all of that. So if it's a really strong connection just grown together, you have to reoperate those horses. You have to lie them down and open up along the scar and remove that scar tissue and let it go, so that funiculus of this spermatic cord is flipping up into the abdomen where it came from. That's what you want. So then you have to reoperate. The same goes, because it could also be the nerve, like a neuroma. So the nerve has got crunched and it can start to regrow, which creates pain too. Those you also have to reoperate. And then you have ones that have just tension in the area. And I don't do rectal treatment, but I'm sure it can be done. I just don't favor that people stand there with their arm in the horse for 20, 30 minutes. I don't think that's nice for the horse, even though it's sedated, but I don't know how we would feel after 30 minutes the next day. So, so we can do that. I actually have another way of doing it, and that really works when it's the muscle, because there is a muscle to the testis, to the testicle. And it is used because the sperm cannot tolerate a huge heat difference. So if it's cold, the stallion will pull up the testicle by a muscle. And that muscle is coming from the abdominal wall. And sometimes the problems with the castration scar is the contraction in that muscle. And that you can do from the outside. So I put a needle in what is bladder 28. So it's a bladder point on the back. Just next to the SI joints. And then I grab the castration scar with my other hand, and I just slowly release it. Find where can I go with it, and all of a sudden you can feel, whoosh, then the muscle let go. But that's not all of the cases. So you can see it's not so simple. It's not just a castration scar. It depends on what structure is having a problem. Some you can release by hand, and some you have to reoperate. But the diagnosis is really important.
And did you say that you are looking at dogs as well? That's going to be your next project.
Yeah, not so much, but a little bit, yeah.
Well, that's fascinating as well. I mean, a lot of the people that watch this have dogs.
Yeah. They can as easy get problems from the castrations as horses. I just think we feel it more in the horses because we ride them. So that's why we really. And the next thing is that when we castrate stallions standing up, when they stand up, you really can't see what you're doing. And you might not get high enough with your emasculator, and it's easier to not make the things as good as you want. It's easier when they lie down, then you can see what you're doing. So that might be another thing with the horses that makes it more difficult with the horses.
I think I do know many people whose male dogs have got unexplained lameness. So, whether it's related, it's something that I'm pretty sure they haven't thought of.
Yeah, it's really something to look at. And the last one I had, he had this front limb lameness for a long time, and he went through all kinds of examinations, and they couldn't find anything. And I, of course, started with the front leg. And then I interviewed the owner, and I asked, is that an intact male? And he said, no, he's castrated. And you know what? It started after the castration. And so then I said, oh, okay, then I know where to go with this. And when I had the dog lying down, it would curl up. And then I started to work on the castration scar, and he really didn't like it. And then all of a sudden, he just stretched out and stretched the whole body, and it was just like, then everything let go. It was just like, whoa. And then he was get rid of the lameness on that diagonal front limb. So it was like, okay. But the fascia lines that I talked about before can explain that, how that connection is.
Yeah, I mean, fascia is the future. I have been studying more and more about hydration in terms of my nutrition work. And some of the teachers that I've been learning from, they talk about fascia as this wonderful communication within the body, and how really some of them even attribute fascia to being a bit like a watery jelly type substance within the body. And the fact that it is so enriched with water enhances the communication. As long as it's like a live, vital water, and they talk about that the more vital and awake your water can be, the better the fascial communication system within the body.
Yeah, and that's what they talk about. What you talk about there is a hyaluronan, which is a substance that is we know it from joints, so it's in the joints, and it can have a different chain lengths, the composition of it, which means that it can be very lubricating, very nicely lubricated in the joint, but also between the fascia layers. So you may have a muscle in this direction and another in an oblique direction. And if they should move over each other, they need to be a lubrication between them. And that's the hyaluronan. And if the chain length, or if it changes, then it can be very watery, and then it loses the lubricating properties, because water is not lubricating, or it can be really thick and sticky. And there's probably a lot of components that is involved in that, and not enough is known yet, but probably the feeding is an important thing. Because the pH in the tissue also makes a difference in it. So this lubrication, and it's everywhere. It's between the different muscles, and it's in the loose connective tissue. We have this myofascia around the muscle, but we have loose connective tissue between muscle layers, and that's where the hyaluronan is, and everything can slide and glide. But it's also around vessels, around nerves. It's within the nerve, so it's around every nerve cell, so it can move within the nerve, which make it less vulnerable, so it doesn't break so easy. Yeah. So hyaluronan is really important. What is going on now a lot in the human business is that you can buy a lot of creams for your face with hyaluronan in it. But it's really huge molecules. So I'm wondering how that should go into the skin. But you can also feed it a lot. But then I wonder what happens to those molecules when they get into the ventricle. That's something to look at. I don't know, but I wonder if they can slip through and get out into your bloodstream. I don't know really how that works. But maybe it enhances the body's own production of hyaluronan when you feed it, or I don't know, but there's a lot of questions about that. And there has been done some research in Italy in humans with low back pain. They have injected hyaluronan into between these layers, like into the thoracolumbar fascia, to see if they could repair the pain in that aspect. So hyaluronan is really interesting, and it's had lots to do with the food.
Absolutely.
Yeah.
Do you have a question?
That's a thing that will really grow, I'm sure, and we will learn more about that. There's a lot of research going on.
Fiona had an interesting question for you as well. She was wondering if you do acoustic tuning for fascial release, because she did a demo at a recent conference, and she said it was incredible.
Yes, we do use, like at vets, we can use acupuncture needles to reduce points for every, she has found a point for every of these myofascial kinetic lines. So in humans, they work manually on the line from the head to your toes, which takes a long time and it's very painful. But Tove has found these single points for every line, and you can stimulate them with a needle if you're allowed to, but you can also use a tuning fork. So vibration. And Tove Due has done that for many years, and people have been laughing at her, but it's because there are certain mechanoreceptors or nerve cells in the fascia that register vibration. And that's why you can use vibration to treat the fascia, and it will relax. So we do that a lot, and when it's non-vets we have on our courses, they go home doing that, and it works really well. So I will use both my needles, but also the tuning fork equally when I treat the fascia points. You can also, so any kind of vibration or wave you put into the tissue can relax the fascia if it's in the right spectrum. So you can also use light. You can use laser, red light, ultrasound. So there's a lot of options. It's like if you change the tension in the fascia, it starts to release. If you do use too high tones, so more than 440 hertz, you might get a contraction. Or if you leave a kinesio tape on for too long, it might also start to contract. So you have to understand that, but otherwise you can release fascia with tuning forks and have a very good result.
I studied this. Acutonics. I studied it for maybe 2 years.
Okay.
It's like a seven level thing, and I did up to like number 4.
Yeah.
Yeah,
It's
but
a huge thing if you want to
so
go
much
into
to learn.
Yeah.
Yes, I
Yeah,
mean,
yeah, yeah.
I found a book called Acutonics for Dogs. I was like, goodness me, I'm like a sponge for anything like this. So I was like, okay, where is this happening? And it was only, the course was maybe an hour and a half from me. So yeah, I started. It is phenomenal, and I have quite a lot of tuning forks. They're actually, shame to say, I should get them out and start using them again. I use them on my retreats, but other than that, they just hide under my bed. So
Okay.
I should get them out, really.
Yeah.
But they're super cool.
We just use it in a very simple way, because you can get very deep into it, and then you can have a lot of tuning forks. So we mainly use 2, which is the A, which is 440 hertz, or the C, which is 128 hertz. That goes deeper, the C. So so you can do it in a simple way. You don't have to do the whole thing, but I'm sure if you do the whole thing, you can get even better results, because then you will have a tuning for the brain, one for the liver, and blah blah blah. So then you get much more into the depth with it. But
Yeah.
you have,
What are you showing, Tina? What are these?
yeah, that's 440. Yes.
Yeah. Yeah, I'll have to double check what mine were. I had them, they were connected with the planetary hertzes as well, the planetary frequencies.
Okay.
There were certain ones, I think the moon was, that was maybe aimed at certain ailments. So I'll have to go back over it again. It all comes back to me when I get them out. It's how your brain associates, but yeah.
I do a lot of craniosacral therapy too in the horses, and some of them have so much tension in the head that they will not allow me. And if they just lift their head, I'm like hanging like this. So I'd use 128, the C, and I just use the acupuncture points in the forehead here, and they just come down right away, and then I can start working on it. So it really takes some tension out of the head. And you can do, I've done it in dogs too, but dogs can be a little more difficult. Some of them really don't like the sound because it's really high. So not all dogs like the tuning forks. The horses are a little easier that way, but it's a wonderful tool to have.
Brilliant. It's brilliant.
And for relaxation, it's just down the middle. Yeah.
I don't know how horses react, but dogs, I haven't had problems with dogs. They seem
to. You haven't? No. Okay. I've had a couple of dogs that didn't like it. But...
Yeah. Amazing.
And you can, and there's for you people at home, you can, if you want to release the whole spine, you can just put the tuning fork on the spine, just move it some inches, and then treat the whole spine. And there's a very good acupuncture point, which is the tip of the tail, which is very easy. Just take the tip of the tail and put it on, and it will release. So you release the muscles around the spine, but you also release the dura mater within the spine, which is lying around all the whole medulla, the whole spinal cord. So it really has a profound action there, and you can do nothing wrong. You can't harm the animal.
We used to, for some of them, just hold it in their aura, almost hold it near the area. That seems to be enough.
Yeah, I haven't tried that. But that's, I guess it's the same with the, what do we call it in English? Sangskåle, Lise.
Oh, yeah, the tuning, the bowls, what are they called? Tuning bowls or singing bowls? Or...
Singing bowls,
yeah.
That you can also hold it near to the body, and the swinging will heal. So it's very fascinating with waves.
People stand in them sometimes, don't they?
Yeah. And you
Stand
have
up
those
tall.
wave boards that create waves, like shivering boards to stand on, and for animals too, which I think can be really good, but you can use them too much, because if the animal get tired, they will, all the fascia will contract. So don't think
You
that
need
more
less.
is better.
I agree. Less is more.
Yes, less is so much more. That's really important with that stuff.
Tina, what was, we had a horse question.
Yeah, we have a couple questions actually. So one shorter one is from Alicia, because she was listening to Rodney and Dr. Karen Becker recently in an interview, and they were saying to all dogs to see a chiropractor every 6 months of their lives as a preventative measure for wellness. What is your thoughts on that? Who needs chiropractics and how often? And
Yeah, that's a good question. Actually, if like a lot of both humans and animals, when they get born, they can actually get the first trauma to their body. A lot of it will release and they get fine, but for some they get stuck in a, that could be a rotation of the cervical vertebrae or the sacrum or whatever. And then if they live their life with that, they start to go awkward. And then they start to make too much pressure, maybe on one leg or a specific joint, and then they get a setup for injuries. So if I think the good thing would be to check them out, like when they are 2, 3, 4 months old, like with dogs. And the horses, I would do it a little later, 6, 8 months, depending on how they are to handle. And then some of them will be fine, and some will have to have 1 or 2 adjustments, and then they're good. And then depending on what you use your animal for, it can be more or less needed. So when I see horses, because the horses that come to me, they have a problem. That's why they come. So I see them maybe 3 times, 3 weeks between, and then I try to find a period of time that fits them. So maybe every 3 months, every 6 months, and once a year, depending on how their conformation is and what they do for a living, if they are jumping or dressage or pleasure or whatever. But also it depends on how they are treated. How is the rider riding them? Because the rider could be crooked and then the horse get crooked. Then they need treatment maybe every 3 months. So it really depends on what the animal is doing. And with the dogs, if it's a couch potato that only go for 3 walks then a day, then it might not need it so much, or it may need it actually more because it doesn't move enough. And then you have the agility dogs, hunting dogs, whatever, who are really using their body, and they might need it too. So I think it's hard to say a certain time, but like if you say every 6 months, then you should be good, because then you find out if there's something wrong. And then you can also maybe realize that once a year is enough. But we all humans should have a treatment every at least twice a year or 4 times or more. But you say chiropractics. I started to learn chiropractics, and what I find is that some of the techniques, or the most of the techniques, are what they call direct techniques. And if you're not doing it in a soft way, it can be really harsh and painful. Like when I used to go to a chiropractor, and he would say, want to do my neck, and I was like all stiff and said, relax. And I said, I can't, because I know that all of a sudden something happens. So I like osteopathy, the soft techniques from osteopathy, much better, because they don't surprise you and they are not painful. Osteopathy can have direct techniques too, which are as unpleasant as the chiropractic. That's exactly the same techniques, but the soft techniques of osteopathy I really like the most, because they are also easy for yourself. When you treat with chiropractics, people have pain in the wrist and the elbows and shoulders and neck and everywhere, because it's really hard, especially with the horses, not so much with the dogs. But it has to be soft chiropractics or soft osteopathic
yeah,
techniques.
Is it McTimony? It's called McTimony, the kind of gentle.
That's one technique. Yes, that's a gentle technique. Yeah.
Because I've seen this online, you know, like people get famous with their videos because they take a big animal and they crack things in all directions. And
Yeah.
honestly, like I have a vet here that has recently graduated with chiropractics, and you don't see anything. She barely, just a little movement, and you
Yeah.
don't.
Yeah. And that's how I think it should be, the big crackings. But that's, I had to begin with, I had clients, and especially men, that when I was doing the little things, when are you going to do something?
We're not paying for that.
No, they want to hear the crack and see the big movements, but when the animal feels pain, it really creates an increase in the sympathetic response, and they get all stiff and don't want it, and then you cannot get through with anything. So that's why soft techniques, where you can calm the sympathetic nervous system down, that's when you get good results. If you get them wind up, no, it doesn't work really well. So it's anything that can be done in a quiet, simple way, that's to be preferred, definitely.
Yeah, it doesn't look good when they're
No, it
cracking
doesn't.
like that.
I really, I don't like it.
No.
And most people don't like it either if they are on the bench when it's like that.
Yeah.
So, but I think many people think a horse or a big dog is so big that you really have to use force. But you are actually communicating with the nervous system. And that doesn't need force. That needs really gentle touch, but in the right way. And then you don't need force. But it's an interpretation, because it's a big animal, a horse. Then people think then you really have to use a lot of power. But it's really wrong. It's you don't. Less is more. It's really my motto. Less is more.
We do have another question from one of our followers called Elaine. It's a bit of a longer question, but I'll try to keep it short. So she has a horse that's been diagnosed with osteoarthritis bone spavin in his hocks. He was lame at trot, has been with me since he was 7 months old. He's a Shire, he's 15 years old now. His left hock is worse. There's a large lump on his left hock. He was lame recently at a trot in the field. He's also a sweet itch sufferer. I already started him on homeopathy from an osteopath, and he's on a joint balancer called Blue Chip. We've been looking into CBD oil, hemp pine, and also borax. Any advice would be appreciated. Want to avoid injections. I do not want to bombard his body with too much, otherwise I will not know what is working. Yeah, it's just been started on the joint balancer, and he lives with 2 other horses. Yeah.
Yeah, and you showed, I saw a picture of this horse, so it has a huge lump on that one limb, hind limb. So spavin is one of the cases where you can use holistic medicine to support, but in some cases, maybe not exactly this case, but when it's starting up, sometimes it actually is a good idea to use cortisone, which is injected into the joint. Because what happens with spavin is that the cartilage in those little joints start to degenerate, and that is painful. And when it's totally degenerated, there's a ankylosis, so the bones grow together, and very often they get pain-free when that happens. So the cortisone actually helps break down the cartilage faster, to make it grow faster together when it's on that right stage when you use it. So sometimes I use very little cortisone, but that is one of the cases where I actually find that it is a good thing to do. And what you inject is a very small amount, because you cannot have a lot in that joint. So in that aspect, I'm not worried about it because it of course has a general function on the whole body, but it's mainly in that joint. So that sometimes it's what you need to do, even though you don't like corticosteroids, then sometimes it can be good, and sometimes it's necessary. But then the homeopathy, I think she has ARR, so Arnica Ruta Tox or something like that.
Yes, so
Already
she had RRA, Ruta Rus Tox, Arnica, Angostura humoris.
Okay, so yeah, there can be more remedies that are good for local joint pain like that. And that's maybe more your field, Caroline, with the feeding, like feeding MSM and hyaluronic acid, actually. I think it's in it, or what? For joint pain.
Oh, yeah. Well, this would be along the lines of supplementation rather than food, I think. But yeah, it sounds like
supplementation. Yeah.
yeah.
So saying in this case, I don't think she can do more than she does. And it's totally right not to do too many things at one time, because then you have no clue what's working. So in this case, I don't think you can do more than you are already doing. I think it sounds good. But in the cases of when a horse start out with a lameness, be it a stifled pain or spavin or whatever it is, it's very good and important to look up how is the back working, because it might come from there. Because if the animal is working with the or walking with the back always low, so in extension, it will put a lot of pressure on the joints in the hind limbs. So if you can make it work correctly with the back, the joint pain may just disappear because it starts to work in the correct way. So only treating one joint, I don't, you have to treat that, but you also have to treat the rest of the body. Otherwise you won't succeed with it. So it's important to also look what else is there. But she has an osteopath. Did you say that?
I don't think those treatments were mentioned. I was going to ask whether that wouldn't be indicated at some point in the horse's care to have some osteopathy or acupuncture or something like that.
Definitely. Because that would be very wise to do that, because so often the joint problems comes from the back. But that's not what we have learned as vets. Like when we were in vet school, they said like 90% of lamenesses came from the hooves, which is now absolutely not correct. It may have been correct back when they used the big heavy horses to drag the wagons in the Copenhagen streets with the stones, walking on stones all the time. But now it's like anywhere in the body and anywhere in the leg. But very often it's because the posture and the spine is wrong. And then they put the weight distribution is wrong in the limbs. And then that create or set the limbs up for injuries in the joints or in the tendons. And if we get back to the fascia again, like every muscle cell is wrapped in fascia. Every bundle of muscle cells are wrapped in fascia, and the whole muscle is wrapped in fascia. So it's 3 layers of fascia coming together and forming the tendon. And when you talk to vets treating these tendon problems, they only look at the tendon. They don't even look at the muscle where the tendon is coming from. And then not even at the whole posture of that leg. So if you really want to do something about tendon problems, you have to look up and see, where does the tendon come from? What is the posture? How does that leg stand? Because if the horse always stand in a certain position with that leg, that puts tension on that tendon, then there's a setup for an injury. If it steps down in a hole or something, then that is the tendon that snaps. And then you have to also look at the muscle to cure that horse. And that's not what's being done now. And I really, really don't get it. I asked a lot of times on conferences when I hear about tendon problems, and I ask, what about the muscle? And they say, no, it's not important. I'm just like, how can you say it's not important? The whole tendon comes from within inside the muscle. So of course it is important. So there is something, but that's because we talk about lamenesses that's in the legs, and then a horse can have back problems. It's not coordinated, but it hangs together so much.
Yeah.
So
The only
yeah.
thing the only thing I would add is obviously now he's already doing some treatment, but if she can find a good acupuncturist, I was also thinking
that would be nice
changes
to add.
usually.
Yeah, that would be nice to add on. The thing is, what for me, I've seen it, the problem is that you often need quite a lot of treatments, and that could be an economical barrier for people to not wanting to do that. So, but yes, that could be another add-on. That's true.
Yeah, potentially some Chinese herbs. And I do wanted to ask you, what would you recommend in form of training for her? Obviously it depends, but
it's really hard. It depends on that case, and it depends on the back of the horse. And I think it's hard to answer that question in this case. But that said, very often spavin horses it's better for them with motion. So it's not good for them to stand still. They should be able to move. So be out in the pasture and maybe walk them if it's lame, not ride it, but walk it. So movement is important.
Very well. And I wanted to ask you a question. Can you tell us a bit more about craniosacral therapy, for those who doesn't know what it is?
Yeah, I can do that. I see a lot of horses that have been treated by other people before, and very often they come in with that. The main problem is the craniosacral system. And the craniosacral system is everything that is within the spine and in the brain. So we have the brain and we have the spinal cord. And around that tissue is what we call pia mater. So that is a meninges just close to the nerve tissue. Then there is a little space, which is called the arachnoid layer, where we have the cerebrospinal liquid. And on the outer layer is what we call dura mater. So it's a hard fascia, fascia around the brain and the whole spinal cord. And in the brain, it's stuck to the cranium. And then we have the cerebrospinal liquid, and then we have the brain tissue itself. In the spinal cord, it's just around the spine and not attached to the bone. But there is attachments on the way. So there are really, especially in the horse, there are attachments in the upper neck, in the lower neck, and in the sacrum. So that means that dura mater, if the sacrum is unbalanced or maybe sitting in an oblique angle, it will pull all the way to the cranium. So there will be a pull. Also, the nerves is coming out from the spinal cord all the way between the vertebrae, and they also run out through this dura mater. So you can imagine if there is a pull on that dura mater, it pulls all the nerves also. So then you can have pain in the whole spine. And it can show up like with many different symptoms, because depending on which nerves are the most, do have the most pressure on them. So what you do when you treat with craniosacral therapy is to try to release that tension in the dura mater, and also on the fascia on the outside of the cranium, because and all the muscles around the spine, because they also create a tension. And the spinal fluid is actually around the brain, and then it's cerebrospinal fluid running down the spine and up again. So there should be this movement of that fluid back and forth. That fluid will nourish the nerve tissue, but it will also collect waste material from the metabolic processes. So it's really important that it's fluent back and forth. And if the dura mater is too tense, that can't happen, because then there is no movement. So what you do is, first of all, you have to find out, do you need to start with the sacrum or the cranium? Depends on the case. Sometimes there's so much tension in the cranium that the animals will not accept you to start work there. You have to start then on the sacrum, release that, and then you can get on the head. So why do we get a craniosacral system that is stuck? It can happen if you hit your head, for instance, or if you sit on if you're human and you fall on your butt and the sacrum get crooked. So in the animals, that can happen too. Any kind of injury can really create a tension in the craniosacral system, because the body wants to protect the spine and the brain, which is the most important thing in the body, almost, if you can say that. So the body tries to protect around, and everything contracts around it, and then it's stuck. So then you have your different bones in the cranium, and you put your hands on and you feel for symmetry and for movement. And then people say, well, everything is grown together and can't move, but still you can feel the movement inside of it, of the cranium. And that's what you're aiming for, to get that, normalize that movement, so you have the flow of the cerebrospinal fluid coming back and forth. So it's a really powerful tool, but it's also difficult to learn. I think it took me 3 years when I learned it first to understand what I was feeling. So I see a lot of like weekend courses in craniosacral therapy, and for me, it's there's no way you can learn it in that short time. And if you don't do it correctly, you can actually harm the patient. So the people you use to treat, that you want to have to treat your animals with craniosacral, be sure that they have a good education and experience, because you can't do things wrong. I remember when I learned it first, or second time actually, with another teacher, we had to practice on each other. And the woman who was treating me, she would use so much force on and this area on my head. And the next day I couldn't chew. It was so painful. And I had to have the teacher to retreat me so I could then start chewing again. So you can really make things wrong if you don't do it correctly. So I really will emphasize that people should use people that have a good education.
We had somebody at the expo this year, Tina, didn't we, that was exhibiting craniosacral. I must find her. And I actually did mean to look into that. Jennifer, she was exhibiting this at our annual conference.
Yeah.
Health for Dogs conference. I think the craniosacral system, not that others aren't as well, but in particular could be influenced by the yanking of a dog on a lead, you see.
Yes, definitely. Definitely. It can, yeah. And I also, if they hit their head, like I had one recent schnauzer, and I never forget it, because I just wanted to pet it, just to say hi, and it almost bit my face off. It was like so close. And then I realized it had hit its head in the car door of the car, like the corner. So it had so much pain in that head, and was really an angry dog. It would attack other dogs, and it was really difficult for the owner. And when I had treated it a couple of times, it totally changed behavior. So it can really, it has a huge impact, both on the physical body, but also behavior. And it can have impact also on the organs, because depending on which nerves are getting caught in that system. So it's really powerful, but it has to be gentle and with skilled people.
Can I ask, have you ever tried treating a dog with like hydrosyringomyelia?
No, I haven't.
That would be very interesting.
Yeah, that could be interesting, but yeah, it could
Yeah,
be.
you have a major obstacle to cure there, though,
yeah.
because the confirmation is it's not going to place, because there is no place.
No,
there is no space.
But I have treated swimmer. What do we call that? What do you say in English, Lise?
Swimmers, I think.
Yeah, in puppies.
Yeah.
Not only with craniosacral, but also and they are very often just the whole spine is extended. And if you get that released and the craniosacral system to go, then you can get them perfectly normal. So I know people who just say, well, they will never be a dog out of them, but that might not be true. Some of them can really be helped by, but you need to treat them early.
So what kind of dogs do you recommend go see a craniosacral therapist? What kind of issues?
Like if you know that they hit their head, that would of course be obvious. But also if they're very stiff in the spine, so if they're very pacey in the gait, that happens to horses too, that because when they stiffen the spine to protect it, they get stiff in the movements and they get pacey. So that could be a local problem in the spine, but it could definitely be the craniosacral system. And then if you have these cases where they are a little lame here, a little lame there, or they get stomach ache, or like little things that you can't find out why is that, and it's coming recurrently, very often it's coming from the craniosacral system. So there's kind of all kind of patients that can gain from it. But again, your diagnosis has to be correct. But when you do it in the right way, you don't harm anything. If the dog is fine in the craniosacral system, you just work with it and play with it and have the cerebrospinal fluid come more up and down, and that will be a good thing for them to get a treatment, even though if they don't need it. But most of us too needs it. Like we all hit our heads or do something stupid things. So yeah, and it's very nice. You get really relaxed and tired afterwards, because it will reduce the sympathetic nervous system. So you will be calmer afterwards, and the animals can get tired. The horses can. I have had horses that slept for maybe 1 or 2 days after, because they all of a sudden let go of all the pain and all the stress and just relaxed. So it's very powerful.
Oh, we're so lucky that you've been here today. It's been so interesting.
Thank
We
you.
haven't got to many questions, but I don't think we needed to, because everything you've said has been just so fascinating, hasn't it?
Okay,
Fascinating. That's the word.
Ah.
I haven't heard that one
Not
before.
just after the other.
That's the name of your new book. It came fascinating.
Fascinating.
We are actually going, there's a fascia congress every 3rd years for humans and also vets. So it's now held in New Orleans in August. And we actually have 5 papers to talk about there, to represent there. So that's very nice. So, and it will be interesting to hear how far they have come with the hyaluronan research and in humans. I look forward to hear that. So maybe I have news in the autumn to tell you.
You're definitely coming back, and you can tell us. You can tell us all about that.
Yeah, if you want, I will be glad to do that.
Excellent. We'll put you in the diary. Perfect. Thank you so much for joining us. Thank you. And
for doing this.
You're just so much information that spinning with more questions, but we're out of time. So thank you very much for being here. And let's promise everybody that you'll be back.
That's fine.
I will.
For sure. And next week we will be back. Tina, who's our guest next week?
Let me check. That's on here, isn't it? Next week is Emily McAtee.
Oh, yes. She is fantastic veterinary homeopath from Dublin. Will be here with us next week. Yeah.
Exciting. So lots of questions. Lots
of questions. Keep them
everyone.
coming, and we'll see you.